really is no introduction to my drawing skills, but we're gonna try this. So this is you, okay? So today we're gonna be talking about hip flexor tension, and I'm gonna show you my personal favorite way to release muscle right here on the front of your thigh using drawing. So bear with me for a second, okay? So like I said, today we're talking about your quads. I wanna highlight what happens when your quads become tight. One of two things will happen. A, you will either have an issue come up with your knees. So let's just say this is you. Let's say this is me standing like this, okay? So this is to the front of your body, this is to the back of your body, okay? It's you in this plane. What happens is, this is your knee right here. This doesn't work. This is your knee, and this is your hip, that's your trunk, that's your head, and that's your feet, okay? That's just for perspective. So your quads will run from here to here. And what happens when these fibers become tight? When they become tight, they shorten it and they pull from here down and from here going up. Meaning when you have quad tension, one of two things will happen. You will either have knee pain right here, or you will have hip pain. And what happens is that you typically end up with obviously knee pain, or you end up with hip discomfort or lower back pain as a result of having tight quads. So in summary, don't forget, muscles always pull, they never push. So when these pull, your hip drops down and your knee rises up. That's not a good thing. So like I said, today's video, I'm gonna show you my personal favorite way to stretch these problematic muscles right here with a very simple stretch. Follow me. You're gonna wanna get onto the floor, or actually, just to go into a bit of theory, when your hip gets pulled down by your tight quads, what happens is that you go into what's called an anterior tilt. It's when you stick your bum out backwards. That's an anterior tilt. The opposite is a posterior tilt. Just keep that in mind because we're going to kind of utilize that theory doing the stretch. To perform the stretch, what you want to do is lie sideways. You want to get into this position here. So if we're going to stretch this under leg, what you want to do is grab that leg by the ankle. You're going to twist your body. And right away, this is an effective stretch, okay? You're going to feel something happening right along over here. So going into the theory that we talked about, an anterior and posterior pelvic tilt, once you're in this position and you're comfortable, what you want to do is start utilizing your anterior tilt, arch your lower back, breathe, do a posterior pelvic tilt, and you want to keep repeating this. And just as a tip for anyone watching this, if you want to get a more beneficial way to stretch a muscle, you're going to do it by utilizing movements as you're doing the stretch. So give this a shot. Like I said, it's meant for anyone with hip discomfort, lower back pain, or if you're dealing with chronic knee discomfort, this is very effective. It's a fairly safe stretch. Let me know what you're feeling and comment below.